Because right now, insurance is very, very high.
Very high.
It's gotten ridiculously high, and it's going to get higher. If the government gets involved, it's going to become unaffordable for way more people than it's unaffordable now. But the insurance guys, they're getting the knife in the back from the doctors and the hospitals who have figured out how to play the system like a fiddle. So you go to the doctor, and they just charge you for every single thing they can to get up on your insurance. And so do the hospitals. And the fraud there is just absolutely rampant.
But then on the other hand, Jim, they tried to counter that by telling the doctors, well, if you keep the cost down to a certain level, you're going to get a big bonus at the end of the year. It's a kickback. So doctors may sometimes try to avoid giving tests or treatments that a patient really needs because he knows he's going to get that big goodie at the end of the year. So he's sacrificing good care for the patients in order to get the big profit at the end of the year that the insurance company is going to offer, which I think is illegitimate.
Yeah, I think I've heard that's like worse than HMO systems. You know?
Yeah.
I think if you have your own health care, you have, they call it PPO, you get to pick your doctor.
Right, but if you're in an HMO, that's how it works, and most people are.
Right. The HMOs don't want to spend any money.
No, they don't.
They're known for the worst care.
Yeah.
Yeah, absolutely.
So the idea we're getting the best care is just ridiculous.
Yeah,
it needs to be addressed. There's no doubt about it, and Obama's addressing it. And I give him some points for that because it's something that, you really can't turn a blind eye to anymore. No. It's a snowball coming down the hill.
In a way, it almost works in conjunction with it. It's symbiotic to our economy because our economy has been our big main issue. But at the same time, without money, we can't pay for our health insurance.
But the idea of, here's some guidelines and throwing it into the laps of the idiots in Congress to come up with a plan
counterproductive.
Isn't a good idea.
Right.
It's not working. It's not working. He didn't get it.
Yeah, I give him points too, but I give him all negative points. 1 to 10, he's a minus, -5 or whatever. But yeah, because it has to happen. I mean, and I don't, it doesn't seem like it would be that difficult to pull together a number of groups in the private sector, have them come up with alternative plans. It's sort of like companies do once in a while. The smart companies, when they're coming out with a new product or they need to change something, they don't just say, okay, Bob, you go over there and take, Tom and George and Sally and figure this out. And you have one team that proposes one solution. The smart ones go out and they say, we're going to create 3 teams here. Each team is going to come up with their own solution. We expect them all to be different. Then we'll see which one's the best, or maybe none of them will be the best, or maybe we'll take the best things that each team comes up with. Companies like Apple do things like that regularly, and that's why their products are just brilliant, and beyond what anybody else can do. So, it doesn't take a rocket scientist to just borrow a good idea and go do the same kind of thing in this sector, because there's a big problem. And there's so much money being lost. And, it's going into the wrong hands. It's inefficient money. It's not only, the government, money spent any time in the government is very inefficient because their processes are so bad and there's a lot of corruption.
Yeah, the lobbyists, right? The lobbyists say, this is going to affect us, so we're going to get to work on these politicians, and they get to a few of them here or there, and they start monkeying with things.
Lining their pockets. It doesn't take much.
And that happens, in certain parts of private industry, too. So certainly within the insurance industry, the hospitals, these are gigantic medical care systems.
Yeah.
It's like a government unto itself already. It's gigantic. It's very inefficient. So, very corrupt. I've seen bills that we've got where, I'm sure everybody has seen this. You go to your doctor or the hospital, and if you have insurance, even if you don't have insurance, either way, they bill you. And if you do have insurance, what happens is the insurance companies have pre-negotiated rates, right?
Yeah.
So the doctor bills, $1,700, and the insurance company says, okay, we'll allow $500 of that. But they know what their guidelines are and where their limits are. They know they're not going to get past $500, but they bill $1,700.
They bill more anyway. Yeah.
Yeah, because they're corrupt. And then they hope that along the way they'll catch some people, who are ignorant, and they'll end up paying $1,700. That is just such a bad system.
Yeah.
And it's allowed to happen.
It's a criminal racket.
It is a racket. Yeah, you're right. It's criminal, in my opinion. So there's a lot of cleanup that can be done. But, like you say, who's going to do it?
Yeah, who's bright enough to do it?
Yeah.
Who's brave enough to do it? Who's willing to step out and say enough's enough?
Yeah, and as long as they keep saying, well, like you guys are saying, we'll let Congress figure it out.
You
might as well just forget it because it's never going to be solved.
And we talked about this last segment, though, and they're quitters as well. You're talking about private industry. The boss gives a committee a job to do, and if you hit a wall, okay, it slows you down, but you don't just quit. What Congress does, they hit a wall, they can't come to agreement on anything, and they quit. Mm-hmm. It's a dead issue. The bill dies, and no progress is made, and they're afraid to pick it up again. And it takes somebody who is really brave to try to do it, but, they're all afraid of it because they failed.
Yeah, it makes no sense. No sense at all. We should fire everybody in Congress.